morning, Miss Tidd.
Oh, good morning.
My name's Jonathan. I'm a nurse here.
Nice to meet you.
So it's my understanding that you just finished meeting with the lactation consultant?
I did.
Excellent. And you want more information on self-breast exams?
Yeah, I heard those are really important, and so I just kind of wanted to learn more.
Yeah, absolutely. Well, I'm here to teach you about them, okay?
Awesome. Be great.
Yeah, would you prefer a demonstration or just a lecture about it? Or would you like to practice on yourself while we do it?
I'm kind of a visual learner, so I think just like seeing it be performed would be enough.
So, a self-breast exam is something that you want to perform at home at least once a month, generally a week after your period.
Okay.
Okay? As you perform more and more self-breast exams, you'll get to know your breasts and you'll be able to notice abnormalities more easily.
Okay.
Okay? Now, when you're performing a self-breast exam, it's important to make sure you're following a path. You're keeping in order so that you don't miss any area of your breast. You want to make sure you're palpating the whole thing.
Okay.
Okay? So it's best done lying down because that way your breast is most flat and you're able to palpate deeply. But some women like to do it in the shower because they find it easier to move their hand across the skin when it's wet. Either way, you're going to want to have your arm up, and it's easy to just tuck your hand behind your head, and this flattens out your breast to make it easy to palpate. Now, like I said, you want to start in an organized fashion, and it's good to start up by your armpit because remember you have glands along your armpit that could be impacted by breast cancer. And what you're going to do is you're going to palpate. Remember, staying in an orderly fashion. And I'm going to show you a spiral motion. But you're going to palpate with the palm or with the pads of 3 of your fingers here. Mm-hmm. These 3 fingers are going to be the most sensitive. And as you're palpating, you're feeling for any abnormalities.
Okay.
Now you're going to feel bumps that are normal, and then you may feel bumps that are abnormal. So it's important to learn how to distinguish between them. Mm-hmm. Normal bumps are going to be symmetrical. They're going to be rather soft when you push on them. And when you feel one, if you press on it with the pads of your fingers and you move your fingers, it should move with your fingers.
Okay.
So something abnormal is going to be less symmetrical, it's going to feel hard, and when you press and you move your fingers, it's not going to move with your fingers, it's going to be staying in one place.
Okay.
But you're going to feel your glands and your milk ducts, and those are going to be rather circular, symmetrical, or tear-shaped. And when you get underneath your nipple, you're going to feel a little bit of a well there. It's going to feel like a little bit of an empty space, and that's normal also.
Okay.
Feel all around your breast because you have glands even around your breasts, and you want to work in an organized motion. So I was going a little fast there. You want to do it nice and slow, make sure you're palpating and feeling, moving your breast tissue around. So it's important to make sure that you're trying to pick up on any inconsistencies, something that's different from the last time you did a self-breast exam. And when you go from one breast to the other breast, notice if there's any differences between the breasts or if you feel anything that's distinct from anything else you felt in your breast exam.
Okay.
Okay. You also want to be looking for any discharge from your nipples. And if you stand in front of a mirror and lift your arms up, you'll find it easier to see underneath your breast. You want to be looking at your breast for any redness or any swelling or indentations. If you notice any texture on your skin that's similar to the texture of an orange, kind of ripply like that, that's something you're going to want to notify your healthcare provider about. Now, I know that was a lot of information I just gave you. What questions do you have for me?
So the only thing I was wondering was maybe like how much time I should be spending on this.
So it should take at least 2 minutes. And while you're breastfeeding and your breasts are larger, it'll probably take longer.
So what if I'm not sure what I'm feeling is normal or not?
That's a great question. So you should be having a yearly well woman checkup with your provider, and they can help you determine what might be normal or abnormal. But in between those times, if you find anything you're unsure of, you can always call your healthcare provider, and if they think it is, it could be something, they'll call you in and they'll do more checks. All right. Now that you don't have any other questions, why don't you show me what you've learned, and I can make sure you're doing a self-breast exam correctly.
Okay, so I'm going to use my 3 fingers and the pads right here, right?
Yep.
Okay, and then I'm just going to press and go different consistencies or the same?
You want to be about the same consistency. You're going to want to push pretty hard.
Okay.
Yeah, there you go. Now you're feeling better.
I'm just like in this spiral motion.
Yep. That was a good job starting up near the armpit, making sure you're feeling all of the area of the breast,
Okay,
and including the nipple.
Okay, I know I would spend a little bit more time doing that and just different firmnesses then. And then. Is that it?
Yeah, that's it. All right, thanks for coming in. I'm glad I could help answer some questions and show you how to do a self-breast exam. Remember to come in for your yearly visit, and congratulations again with your new baby.
Thank you. Nice to meet you too.
Nice to meet you. Wait, pour it. You ready?
I wish you well with your.
She will.
Hey! Great, I have a mannequin over here. We can walk over and see. Feeling for just everything. That's kind of